This month's in-service is about fluid restrictions. Patients who are having problems with their heart, liver, or kidneys may need a fluid restriction as part of their treatment plan. The reason is that the heart pumps blood fluid and the liver and kidneys filter the blood in the fluid. So when a patient has a problem with their heart, liver, or kidneys, excessive fluid could build up in the body, and this is called edema. Edema makes it harder for the heart and lungs to work and can make medical conditions worse. So the patients are usually put on fluid restriction as well as some medications to help reduce the edema as quickly as possible. The most common types of fluid restrictions we have at Brigham and Women's Faulkner are the 2,000 milliliters per day, which is 2 liters, 1,500 milliliters per day, which is 1.5 liters, and 1,000 milliliters per day, which is 1 liter. We also have other fluid restrictions in Epic, which can be ordered for patients that you may see from time to time. They are 500 milliliters a day, 750 per day, 1,200, 1,800, or 1,900 milliliters per day. When a patient's ordered for a fluid restriction, if it's 1,000 milliliters to 2,000 milliliters, the kitchen will send half of the fluid restriction and the nurse gives the other half. So for example, if a patient is on a 2,000 milliliter per day fluid restriction, the kitchen will send 1,000 of the milliliters and the nurse will give the other 1,000 milliliters while giving medications. Since the 500 milliliter and 750 milliliters are so small of a restriction, the kitchen does not send any fluid on those and the nurse will give all of it. What is a fluid? So our definition of a fluid is anything that is liquid at room temperature. So examples are beverages, soups, Jell-O, ice cream, and popsicles. In Health Touch, you will see the patient's on a fluid restriction and you'll get the allotted amount per day, and that is a per day restriction. So it's important that the nutrition assistant pays close attention and doesn't send all of the fluid the patient can have for the whole day at one meal. Otherwise, if they get all of their fluid at breakfast, they won't have anything left for lunch or dinner. So it's important to kind of balance the fluid throughout the day, and Health Touch will warn you when you're going over. And let's take a look at that now. Okay, so here we have a patient who is on a 2,000 milliliter per day fluid restriction. When we open up Health Touch, we will see that for the day here, we are allowed to give him 1,000 milliliters. And then it gives us a rough estimate that would be about 360 milliliters coming per meal. And as we start to order fluids, Health Touch will add up the amounts we are giving him. When we start to go close to that 360 per meal, we're going to get this warning that we are going over. The nutrition assistant is allowed to override this. And you will see here now we are kind of in the orange, but for the day, he's still okay. He hasn't had his 1,000 yet. This is technically dinner time, but this may be his first meal of the day. So if this is all the drinks he wants, he's okay because he still had room left in his fluid restriction. If he wanted even more fluid, it would be okay because we're at dinner time now. However, if this was breakfast and we were going to give him 700 for breakfast, he would only have 300 left for the whole rest of the day. So that probably would not be a good idea. He would run out by dinner time. So you kind of have to take into consideration what meal you're in, how much they have left for the day, and whether or not you're going to go over that per meal amount. Patients may get a little frustrated when they're on a fluid restriction because they're thirsty their medications that they're on will actually make them thirsty, but then we're telling them that they can't have any more fluid. So some ideas to help a patient that is thirsty but can't have any more fluid for the day: you could offer things like applesauce, pudding, yogurt, even some of the canned fruits like peaches, and mixed fruit cocktail. Those types of things have some fluid in them, but they're not considered fluids, so it can help them soothe their thirst but don't count against them on their fluid restriction. The other thing to remember is the patient gets the other half of their fluid restriction from their nurse. So you could always have the patient check with their nurse to see if there's anything left from the nurse's allotment that they can give. And Health Touch is set to max out. When you hit the per day amount, you will simply not be allowed to order any more fluids. So it's not that the nutrition assistant can override the per day amount. So again, it's very important to not give all of the fluid at breakfast, because then the patient won't be allowed to have anything for lunch or dinner.